Welcome to Small Town Pulse with Steve and Melissa. The podcast where the heart of small town life beats loud and clear. Each week we dive into real stories behind the challenges and successes of living in a tight-knit community. This is where small town dreams, drama, and determination come to life. This is Small Town Pulse, and you're right on beat.
Welcome to another episode of Small Town Pulse with Steve and Melissa. I'm Steve. This is Melissa. And our guest today is Dr. Snider from U of L Health.
We are so excited to have you.
Well, thank you. I'm glad to be here.
Yeah.
Thank you. Well, tell us a little about yourself and let us know who you are so we can get a better feel.
Sure. The big thing about me is I kind of had a one-track mind in getting into the medicine business. I grew up around here, so all my folks and family are here. And so in that one-track mind, I wanted to get home. No matter what I ended up doing, I knew I wanted to be close to home. And so I ended up going through school. I went to Georgetown College and got my undergraduate there, and then went to University of Louisville for the School of Medicine there. And again, I never got too far away from home, stayed there for my residency training, and finished all that up. And then thankfully with partnering with U of L, we kind of started rolling out these ideas about building this new clinic that's going to have a primary care side, which is my focus, and then also an urgent care side to provide some more after-hours care and weekend care for the community. Like I say, all my folks and family are here. All my wife's folks and family are here, so we were thankful to be able to come home and tremendously blessed in that. I've been married for, it's going to be 9 years, actually on June 18th.
Congratulations.
Which is a funny date with everything coming up. That's the day of
That is the ribbon cutting.
That's
That's right.
I'm sure my wife's thrilled to spend our anniversary doing that. But
I'm sure she's proud of you, so I'm sure she
absolutely.
is. Yeah.
We're coming up on 9 years. We've got a little girl that's 3, and she's just the biggest blessing in our life. And so we have a lot of fun, and moved into the farmhouse that that I grew up in, actually. And
wow.
That's where we moved back. My parents moved out, of course. but yeah, we did a little house shuffling there, and have been very blessed and lucky to be back in the community. Never thought I'd say this growing up. Shelbyville was always the place to be, and the big city, if you will. I'm a bit tired of driving to Shelbyville, so I'm ready to get us settled here at home and start practicing. Yeah.
So have you been practicing at the U of L hospital in Shelbyville?
I'm in a little clinic out in front of the hospital.
Okay.
I say little clinic, but a big clinic, several providers there. And so I've been kind of building up patients. And of course, I've been real blessed in a sense to have a lot of Taylorsville folks finding their way over to me and getting established, and hopefully make it a little easier for them here soon.
Yeah. I know when I talked to Aaron from the U of L Shelbyville Hospital, he said, we're really excited. We're bringing Dr. Snider home to Taylorsville.
Yeah.
He said that's like a big push for them. They were really excited about doing that.
That was the goal.
As are we.
That was the goal from the get-go.
Yeah.
So it's, at least 2 or maybe even 3 to 4 years in the making, all this. But
I feel like I've been hearing about this for a long time from the Chamber of Commerce side.
It's been delayed about every possible way you could probably think of from the get-go. Of course, nobody's fault in that sense. Things like that happen, but we were finally making that final push. So now, I've heard it before. I've heard it a lot of times before. We're almost there, but I think this time it's going to stick. So
These last couple months, a lot have been happening in that building.
Very hard.
They have. So it's the most action I've seen going on in that building.
I actually had a chance to stop by there this past Friday, actually, and very impressed with the progress they made. I think things are looking great. I think it'll be just an excellent hub for the community.
Yeah.
So,
So why did they choose Taylorsville?
well, I guess that would be a good question to hear their standpoint from it. I knew I was coming to Taylorsville one way or another. So I was going to be here. So in that time in my life when I was kind of looking around at what the options would be, I kind of spoke to U of L just because I'd been with them. And that's kind of when this idea said, hey, you're a hometown guy, and we've got interest in spreading to Taylorsville, and then also adding this urgent care component. It was kind of the perfect storm of all those sorts of things, and in my mind, granted, I probably could have got to Taylorsville quicker and maybe some other avenues, but in that idea of adding an urgent care to the community and
I don't think we've ever had one,
no,
have we?
no, we haven't.
Yeah.
So adding that kind of extra layer of support for folks, it kind of made it was an offer that was, I kind of jokingly have told people, at the time it was an offer that was either too good to pass or too good to be true. And I hadn't figured out which one it is. I think it's going to be true here soon enough.
Yeah, definitely.
So yeah, just tremendously, all things kind of work together in that sense, and tremendously blessed to be able to be a part of it, and that, to come back home. There's no bigger blessing than to be able to come home and to work with your friends, your family, the folks that really supported me over the years, me and my family. So that was the goal in all of it, and I think we're finally starting to get there.
Now, there's also a Dr. Snider dentist.
Yes.
That would be my brother.
Okay.
That's my brother. We're about 9 years apart.
And he's literally going to be about across the street
He's
from you,
across the
right?
street.
Yeah.
We look at each other. We'll probably find us at lunch there at hometown or Fresh Lake,
Right.
wherever. So, he's across the street. He's 9 years older than me, but we're tremendously close for our age difference there. And so, he and his wife and his family have just been the biggest supporters and mentors to me through it all. So,
Awesome.
if you ever seen him, I can't deny him. I look a bit too much like
Do you-
him.
I've been there.
I'll have you-
I've been there.
I've
a
not had the
couple of
pleasure of
times,
meeting him
and
yet.
Yeah, I have. They do. I was like,
You
they
look
do
awfully
look-
familiar.
Yeah,
We got the wrong guy.
yeah. I was like, I know he was older when I met him the first time, but so yeah, you do look a lot alike.
Well, your parents must be very proud, a doctor and a dentist.
I couldn't be where I'm at today without the support I've had from them and many others kind of across
Sure.
Taylorsville and Spencer County. So any proudness they feel, I point it right back to them. So
Amazing.
How has the county and the city helped or felt about what's going on?
So I'll preface by saying this: I focus on the medicine side, so I don't hear all the things, but I know they've been very supportive. I know that this has kind of been a full court effort, full court press as far as that goes. All of the folks involved in the city government and at the legislative level, the whole 9 yards, everybody's been very supportive in that sense. So
I think, too, when you have that backing of a big name like U of L, too, helps a lot.
Sure.
I mean, I think they'd be supportive regardless, but
Right.
that big name carries some weight in a little town for sure. So what do you love about small town medicine?
Well, definitely the small town, when it came to figuring out what my career path would be or what I was going to do with my life, for me, the first step in that was I knew where I wanted to be. And I knew that I wanted to do something, if I could, that would be some sort of benefit or help folks out in some sense. I don't think at any point I necessarily was ever like, oh, I'm going to be a doctor, or, oh, I love the science of medicine and all this sort of stuff. You grow to love those things. But I knew I wanted to do something in that sense. And so as I went through my training and through school and all the different things, that's kind of what it lended itself to. I'm also very thankful Spencer County has a very rich history of excellent medical providers. You've got the clinic there on Main Street that has been a staple in this county and the surrounding counties for generations. If you ask certain people out here of a certain age, I won't say what the age is, but there's a large percentage of them that if they've been here, they were probably delivered in that clinic. And so a long history, I've had a lot of folks to look up to in my life in that sense. That's where I went to the doctor when I was a kid. That's where my arm got set when I had a bad roller skating, my first and last roller skating expedition. And so seeing those folks, the way that they worked and the way that they dedicated both their work life and then their extracurricular life, to the community. They worked long hours, they worked very hard, and then they were also found time to be involved in the community. Seeing that was what really, I think, drove me to say this is something that I wanted to do. When I went to medical school, you can say a lot of things about me, but I've been consistent. I didn't really want to do anything else but get home and do primary care. And that's really the reason, those folks and watching their impact on the community, and then being able to play my whatever small role I can in that.
So you really have a servant's heart then.
I guess you can say that.
Yeah.
Some days it doesn't feel like it, but yeah, sure.
That's what it sounds like.
Now, I know sometimes it gets hard being a doctor and then separating that from your life outside.
Both being in a small town,
especially
yeah.
being in a small town. How do you try to cope with that and try to separate that?
Yeah. So that's a excellent point, and I can't tell you how many people in my career, as I told folks what I wanted to do, and going back to your hometown, you can get a lot of naysayers, I guess, out in the whoever you ask, somebody's got an opinion. Yeah. I heard that, and I understood kind of where they were coming from with some of those things, but again, to me, I think it seems like such a responsibility, but such a blessing to be able to be a face and a person that people can know and can trust in that sense. And I'm going to go to Country Mart, and I'm going to go to Hometown Pizza and all these places, and if I see you, now bear with me, I don't have your name in front of me like I do in the office. But,
You're not walking around with their charts?
But if I see you, I want to know what's going on. I want to be a part of your life in that sense too. And so, all of those things, I've seen it modeled to me in in those folks I mentioned, but I see that as truly a blessing and an opportunity to have a deeper relationship with your patient, more than just that 15 minutes that you get in the office or whatever it might be.
Maybe once a year.
Sure.
Yeah.
Yeah.
Now, obviously, you haven't started practicing in a small town yet. Shelbyville's not a big town by any means, but it's big compared to us.
And what I would say is my patient base now is mostly Spencer County folks that make their way over there too.
Is it? Okay.
So yeah, I've been very blessed, and I got a lot of friends out there and supportive folks that have made that little extra drive to come see me. So I really think we'll be busier when we get here in a sense, although we're getting very busy now. But I think in a lot of ways that won't change too much for me, that transition from Shelbyville to here in Taylorsville.
I'm sure your patients are excited about not having to make the drive.
We're all none more excited than I am. We're all very excited.
I can imagine. The timing is kind of perfect too, because I think the clinic that you're talking about, the Nortons on Main Street, is no longer there because of some building issues. So those doctors have gone on to other practices.
And what I'll
So
say
we're
is
in need of care.
Spencer County is such a growing area. We need more providers.
We do.
We need more providers to kind of meet the need out here. And so I'm hoping that's a temporary thing. I'm hoping, in that sense, Spencer County, Taylorsville, don't see me, don't, see whoever, but just get the care that you need in some way, form, or fashion. So.
Do you think that's an issue in smaller towns? Do you think we don't go to the doctor as often as we should?
I think in Taylorsville there has been some history of a little bit of revolving door in sense, and again, excellent folks that came through here, but for various reasons, most of them it's very important, they would be here for a few years and then they need to move on for whatever it is.
Right.
I do think that makes it challenging on a place like Taylorsville to not have somebody that really is a staple that's going to be there in that sense. I think the needs kind of vary, and I think the idea around things like preventative health and preventative care are changing in a positive way. I think if you went back even 20 years or maybe even less than that, the idea of seeing a doctor when you're not sick around here and elsewhere may seem kind of like a crazy thing.
Right.
But I do think that that's changing, and I think as we advance in what we have to offer folks as far as screening and that sort of thing, and the importance of catching serious illnesses earlier, I think as those things advance, it just becomes more important. And I think people are, in my experience with small town folks, especially if they've got it from somebody they can trust, I think it goes a long way in getting good things done.
Yeah. Do you think that's just some education we need to do in the community just to Get them thinking through those things?
I'm a big believer as far as the way that I practice that I want the patient and I to talk about the facts of what we know. I want to talk about the literature, what the literature says, what the studies say, all these sorts of things. I want to talk about that. I want to make sure that they have all the tools and all the information that I have. And we can break that down as many ways as we want. At the end of the day, what we decide to do with that, I want that to be their decision, And so I feel like as a healthcare provider, you're doing your job if you can explain it in a way that is, able to be kind of taken in and understood, and explain the consequences of all the different aspects. And then at the end of the day, that can be the patient's decision. And whatever decision they make, that's certainly,
Support them as best as you
support
can.
them the best you can in that.
Yeah.
Absolutely.
And a lot of providers are not that way.
A lot of personalities out there.
Yeah.
Folks can be
Yeah.
sure.
Yeah.
There's a lot out there that say, well, this is your best form of medicine to go by, and I don't care what anybody else says. And then there's some people that'll sit there and listen to you and say, well, if you want to try a more natural way of trying things, well, try this. And, and that's a great thing. Like, I've had that issue with some of the doctors where I've gone. So I was one of those types that I don't go to a doctor unless I have to. And
They still exist.
yeah, they do. And I mean, my first doctor was my pediatrician, and I had him until I was like 30 years old. It was you grew right through him. But it was one of those things where if I told him, this is what I'm feeling, but I think I can use this, or this, and he'll sit down and say, well, that wouldn't be good for that. And so it's great to have that type of communication with your doctor.
It's all at the base. It's all about the relationship that you build with whoever you see. You want it to be built on trust, and you want it to be built on, you want to have somebody that's going to listen to you. You want to have somebody that's going to work with you. And if you have problems or questions with the plan, you want somebody that's going to explain their side or talk about it. Make that in a way that it works best for all parties.
Throughout your career, what are some of the challenges that you have faced that?
Well, that's a good question.
It's a very broad question.
I think the challenges. I mean, every day can be a challenge in its own right.
Right.
I think for me, at least I'll speak to it currently. I've moved back home. I'm here in my hometown. I've involved in. Attend First Baptist Church there, try to be involved there where I can and be involved in the community in that sense. And I've got a little girl that's 3 that's absolutely just the apple of my eye, absolute blessing. And my wife, I didn't mention this earlier, she's actually pregnant at the moment.
Congratulations.
Yep, we're very blessed there. And of course, the funny thing about it, timing's not been my friend. Our due date or when we suspect this baby will get here is about the last week of June, first week of July. So,
very soon.
So there we go.
Yeah.
Right on.
You're
time.
about to have your biggest challenge.
Exactly. So I do think there's an element of balancing work life and then being a supportive father and a supportive husband and my roles out in the community and kind of balancing those things out and of course, time management becomes super important in there, and if you ask any of my patients, you'll find that we tend to be a bit of a talker. We take our time. I don't think I've had a 20-minute visit that's actually lasted only 20 minutes, maybe since I've been there. So I try to take my time with every person and make sure that they're heard in that sense. If I run over a little bit there, well, the next person I'm going to take my time with them too. So. That sort of mentality, I think the work, you put in the things that are most important, which in my mind, I think that's the patient interaction and that's the kind of making a good game plan as far as moving forward. I think the balance of all the back end stuff and all those sorts of things while also balancing it with family life and kind of fulfilling all those other important and blessed obligations. I think that's the challenging part of it all.
Yeah.
I'm very thankful in that sense that I've got the most supportive family and friends that the world could imagine. So if I was doing any better in that area, I couldn't be doing any better at all. So, But yeah, I think that can be the more challenging part, is just navigating those things. And I think that's something that will evolve and get hopefully better as I finally get out here to Taylorsville and kind of can be that person.
Yeah.
So.
And you don't know what the challenges are ahead too. When you're from here, now your practice is here.
Yeah.
You're going to be out to eat with your family. Somebody's going to be coming up trying to tell you about their medical problems. They're just going to scooch in that booth with you probably and try to tell you, and you're going to have a whole new host of things to navigate.
That can be okay. I'm there to take care of folks. So that's at the end of the day, that is what it is, and it's the life I've signed up for, and I'm thankful for it. So.
It's a great attitude to have,
Yeah.
because it's kind of like you kind of become like the town celebrity. Everybody knows you around town and sees you, but it's like you go out to eat and all of a sudden you run into Robert De Niro or somebody, and it's like you don't want to go bother them, but you have a question you want to ask. But yeah, to have that attitude, to be able to talk to people outside, makes it a lot easier.
I'd much rather talk about your yard or
Right.
my
Yeah,
garden,
definitely. Right.
I got
medical things to the medical hours, but I understand.
To privacy.
things
Yeah.
are-
Right.
things are-
Yeah. It kind of almost reminds me of like old timey the doctors in a town, right?
Mm-hmm.
The doctor was like, it was who you talked to about everything, right? You always were talking to your doctor.
Well, I think a lot of that, my mentality around that, goes back to the examples that I've been able to have here.
Right.
First Baptist Church located next to that clinic. I saw the doctor there opening up the back door on Sunday mornings. I mean, at least several times, countless times there. To get somebody worked in, or somebody that was having some sort of emergency or issue.
Yeah.
And it was that type of dedication that really, I think, spoke to me and all that.
I think especially in a small town, I think that's the two people you trust the most outside of your core family, pastor and your doctor.
Yeah. Say that they're going to have clinic and
Yeah, so the way it's set up now is half of the building is a row of clinic offices for primary care, and then the other half is set up for urgent care.
Okay.
And don't quote me exactly on the hours, but it'll be like extended hours, I think, for the urgent care, and there'll probably be changes and modifications in that as we kind of work out and see what works best.
I'm sure all of the sports parents are very excited about that, because that would make me nervous as a former sports mom. My son didn't go to the schools here in this county, but we had to drive quite a ways to an urgent care.
And I think that's one of the other things, and I don't want to speak out of turn as far as what I know. I know there have been talks of hopefully getting some specialist care out here, and like folks that rotate through a time or two a month, or
that'd be
on some
amazing.
sort of
That'd be
schedule. And I mean, again, when I this is going back, I don't know, 6 or 7 years, or maybe even longer in the making, that was kind of what I had hoped for Spencer County, to have some sort of clinical sort of situation where we could have specialists rotate out, and we could get that specialized care here to folks. Because, there's a whole world of folks in Spencer County and Taylorsville that, go to Louisville every day, or Shelbyville every day, or wherever. There's also a whole world of folks that are perfectly happy not leaving county borders, and if we can bring it to them, I think that can make all the difference.
They might get the care they need, or the test they should
I
have,
probably fall on the latter candidate.
right?
At least after this last couple of years.
Yeah.
well, we also have some pretty good rehabilitation places
Yeah.
out here. So you have plans to work with them on?
Well, already am.
Okay, awesome.
Absolutely. Those sorts of things, physical rehab, occupational therapy, all those sorts of things. Really, I can sit in my office and tell you what I think and write you a prescription or whatever. But that work of doing that and working through those things, that's really what makes the biggest difference. Yeah. And so working strong with all of our partners in that, and taking the team approach as far as whatever the problem may be, figuring out a way to put our best foot forward.
We have some great mental health professionals in this county as well. That that's just another aspect. I know it's another spectrum of medicine, but it's also, again, so needed.
Yeah.
And for you guys to work together and just do what's best for the patient, get them the care they need, regardless of who the provider ends up being or whatever, but just taking it from this all-encompassing approach, right?
That's, the primary care doctor's job is to, kind of treat and handle the things that we can, and then work to get you plugged in with the right resources to get whatever it is on the right path. So
I guess it would be the best way to say Taylorsville, Spencer County, taking care of Taylorsville, Spencer County.
yeah,
Always.
that's a great plan.
Yeah, that's awesome.
I love it.
So.
Tell us about the open house.
So my understanding is it's going to be June 18th. That's a Wednesday, next Wednesday actually. And I believe the time is 11:30
Yes.
to
1 o'clock.
to noon, 1 o'clock, somewhere in there. They're gonna we'll do a little ribbon cutting ceremony, say a few words, that sort of thing, and then open the clinic up, let folks take some tours and kind of see what we've been working on. And then hopefully, I haven't exactly heard the fine details. Hopefully, some little sandwiches or something like that too, just to celebrate and have a good time.
It's over lunchtime, so I bet.
Yeah, I hope so. So
That's cool.
It's going to be fun. I mean, I feel like we've been waiting on it for so long, and I know I've shared in the local community groups about it, about the open house and the ribbon cutting, and so many people are ecstatic that this is happening, that this is coming here. They're very excited about
I
it.
hope we have a big crowd. I do,
Yeah.
just because I want folks to come see what it's about and see. I think it's going to be a big thing for the community, so I'm thankful for it.
Yeah. And so it's in front of the Settler Center, so it's in the old Froman's building, right? I think a lot of people who've been around this town for a long time know exactly where that is, but just right there on the main strip.
Yep.
And then are you open for business after that?
So my understanding is the tentative plan, and again, there's a lot of moving parts.
Right.
As there have been.
Yeah.
The tentative plan, I think, is to really start operations on that following Monday. And I think my understanding, urgent care will likely open that day. And then I will be here. The caveat for me is I'm having this baby.
Right, yeah, right.
So I will be probably a little bit absentee in some sense whenever baby gets here, just to get things settled at home. But I kind of fully expect by August itself, I should be in for the full swing of things.
That's the great thing about having the backing of U of L, though. They have other doctors to plug in when you can't, right?
So, for my patients right now, and I don't know that we've ironed out all these details, but probably there'll be some level of support from the clinic that I'm working with now, kind of through that period. And then, of course, for like acute issues or things that come up, the urgent care is going to be more well-staffed in that sense to kind of get those things handled.
Do you have a website that they can go to or any information? I know it's not the medical side. It's not the medical side, but
He has already prefaced this multiple times, Steve.
I am sure that it's on the UBEL website somewhere. I know they were putting it in the Spencer Magnet. I know they were posting it on Facebook a couple times. That sort of thing.
And they can find information on it on the Spencer County Taylorsville Chamber of Commerce.
I'm sure that somebody will re-up that and all that sort of thing.
Yep.
And of course, don't worry too much about RSVP or anything like that. If you're
Just
in the
come.
area, just come and check it out.
Anytime between 11:30 and 1. Yeah.
That's right.
Well, thank you so much for your
you.
time. This has been
Absolutely.
great and so informative. And I've heard your name for so long. I'm so excited to finally meet you in person.
Well, I'm excited to be coming home.
Yeah.
So save me some mileage on my car. Roll down the hill. So.
That's a wrap on this week's heartbeat of small town life. Thanks for tuning in to Small Town Pulse, where stories are shared, voices are heard, and the spirit of community always comes through loud and clear. If you felt the pulse today, make sure to subscribe so you never miss an episode. We're here every week with more small town dreams, challenges, and everything in between. Until next time, stay connected, stay inspired, and keep your finger on the pulse. This was Small Town Pulse with Steve and Melissa, and you're right on beat.